So what is chronic fatigue syndrome, otherwise known as ME or CFS? Well, in this video, I'm going to share what different views doctors have about this, the two core areas that they tend to focus on, and then 3 strategies that you can do that I think will really help you. So let's get into it. This is a big subject, but I'm going to try and break it down easily and simply for you. Many people say that chronic fatigue is, if you look it up, a complex disorder. It's a brain dysfunction. It's a central nervous system dysfunction. It's a disorder of the mitochondria or the energy delivery systems. Let's have an overall look on the 2 areas that most specialists are focusing on, and this will help you as you go ahead with your treatment. Now, just a disclaimer, I am somebody who suffers with chronic fatigue syndrome. Thankfully, after 50 years, I'm beginning to get better now, which is such a blessing, and that's why I'm able to be here to help you. But I am not a doctor or a medical practitioner, so do seek medical advice before you try anything. The 2 key areas where specialists are focusing their trials, studies, and expertise in are 1, the nervous system, and 2, the energy delivery system to our bodies. And you might have heard of the word mitochondria. So at this point, I just want to say that the medical establishment now recognises chronic fatigue syndrome, or ME, myalgic encephalomyelitis. So ME stands for myalgic encephalomyelitis. It's taken me about 10 minutes to try and say that over and over again. Somebody with brain fog with ME, those terms are almost impossible for us. How ironic is that? It used to be that doctors would treat people who came to them with a whole host of symptoms, but with clear blood tests, nothing showed up on their blood test. They would actually treat them like hypochondriacs. And there is a book by one ME specialist, Dr. Sarah Myhill, called something like Mitochondria, Not Hypochondria. I'll put the link below. But thankfully, it seems to be taken more seriously as time goes by. So there are a number of specialists who realise that this chronic fatigue doesn't get better with exercise. In fact, if you do it too much, it gets worse with exercise. And we get this post-exertional malaise with exercise. It's not like with normal people, their energy battery, as it were, is increased when they exercise. They feel better, they feel good, they feel energized, just like that Energizer bunny in the battery advert. But people with ME/CFS, their body's battery is so drained that when they do exercise as well and push themselves, then that battery just keeps draining and the energy delivery systems don't replenish themselves. So for some reason they can't replenish themselves. So in the cells, I am not a biologist at all, so I'll just explain this very simply. In the cells of the body, in each cell, I believe, there is part of the cell that is the energy part of the cell, and it's called the mitochondria. And in normal people, this renews itself and you get more energy. But with chronic fatigue, there's some sort of dysfunction with it. They are depleted. And the more we push ourselves, the mitochondria just gets more and more depleted. It can be to the point where people have severe ME or CFS and they have to just completely shut away from any stimulus, from any interaction with people or stimulants at all. So Dr. Myhill, in her book, she talks about why this might happen, and she says it's because of poor diet, poor gut function, poor breathing, sleep, mitochondrial failure, poor adrenal and thyroid function. And she talks about inflammation as well, and says that if you have ME, then you also have inflammation, and that occurs when the immune system is activated, and it's activated with allergies, chronic infections, and autoimmunity. Dr. Hyman, who has a YouTube channel and is a functional doctor in the US, talks about the mitochondria being damaged and there being inflammation in the body and free radicals in the body. And he says that that is caused by gut issues, mold, heavy metals, Lyme disease infection. And he says that a whole holistic approach is needed to get the body back to working properly. So secondly, let's focus on the second thing that specialists talk about with ME/CFS and what the problem is. So these specialists talk about there being a disorder with the nervous system. Dr. Perrin, who has written a book called The Perrin Technique, and I have received that treatment, and I will be doing a video about that with some exercises from the book that could well help you. And Dr. Perrin has done many studies as well, and he talks about there being a problem with the lymphatic drainage of toxins from the central nervous system. Toxins having resulted from infection, pollution, emotional or physical trauma. And he has a form of therapy which is very simple drainage techniques that you do on yourself, which is a very, very simple, light form of massage. He's a chiropractor and he's got lots of chiropractic therapists who do a specific form of lymphatic drainage massage. Other specialists talk about the hypersensitive nervous system. So for a variety of different reasons, your body has got stuck in fight or flight mode. It overreacts to every tiny stimulus, and this causes a cascade of problems with the body, many symptoms, and the body cannot function properly because it is in that panic mode. And those specialists use brain training techniques specifically for people who have CFS ME that helps them get out of fight or flight mode into the rest and digest mode of healing, and to calm all the body systems through retraining your mind. So now we're going to focus on 3 things that you can do that are easy and cheap and could well help you. I will be doing more videos with more exercises, techniques, tools and products that you can use to help you. So the first one is what the brain retraining specialists recommend: to reset a nervous system that's got hypersensitive and is stuck in fight or flight mode. And it is just simply saying to yourself, when you feel that you're getting tense, worried, and in your head you're starting to Google your symptoms, you're starting to panic that you won't be able to do your job or do this or that. You might be panicking that a food that you've eaten might cause a really bad reaction, and all these things that we worry about every single day. Just by saying to yourself, I am safe and my body is fine. I am safe and my body is fine. It just really helps to calm that nervous system, calm the anxiety, the panic, the stress that causes a cascade of negative things to happen in our bodies, and just calm that down and know that everything's okay. Nobody's died, everything's okay. So that's the first thing. The second thing is an exercise by Dr. Perrin, and it is a very gentle lymphatic drainage exercise. So I will be doing a video, as I've said, with all of the exercises that you can do at home, but let me just show you one very briefly. And it is just to use your hands and drain down your head to your collarbone to allow the lymph just to drain out of your body. So you need to stop where your collarbone is. So you just do it lightly because the lymph is just below the skin. So don't push, lightly and slowly. Lightly and slowly. And you can do that for about 3 minutes all around your head. So you need to try and drain from the top of your head downwards. And you can do it up your chest, each side, and get somebody to help you do up your back on each side as well. The third thing that can help, and that's using a salt pipe. You could just get off Amazon. I'll put a link below, with a bit of high quality salt in that you can get when you buy it, and 1 or 2 drops of iodine. This is Lugol's iodine 15%. So all you need is like 1 or 2 drops. You open this up and you put your salt in there and put I would start with 1 drop of iodine in there, and then you just breathe in, breathe out. And you're breathing in that lovely salt and the iodine as well, and it really helps to get rid of toxins in your system, clear out any yuckiness. This treatment is one that Dr. Sarah Myhill recommends. So you just breathe in, and you can do that a few times a day, up to 10 breaths in and out. I don't think you can really do it too much, to be honest, but again, I am not a doctor, so consult a doctor. So thanks for staying to the end. If it was helpful, do like and subscribe, and I look forward to making more content to help you or your loved one. And count your blessings, and I'll see you in the next one. Bye.